Hymenoplasty is also known as hymen restoration surgery or revirginization. So it is a plastic surgery procedure which is aimed at reconstruction of the hymen. So hymen is a thin membrane located at the vaginal opening. So surgery is typically performed for cultural reasons, for religious, for personal and for cosmetic reasons. So what is hymen? So hymen is a thin elastic membrane that partially covers the vaginal opening. Its shape and appearance vary naturally between individuals. So hymen can stretch or tear due to various activities including sexual intercourse, physical exercises like cycling, horse riding, or the use of tampons or menstrual cups, or there can be an accidental trauma. A torn or a stretched hymen does not indicate always a sexual activity, as many factors can affect its integrity. Hymenoplasty is performed for several reasons. The most important is cultural or the religious reasons. In some cultures, the presence of intact hymen is considered a symbol of virginity and purity. Women may choose to undergo hymenoplasty to meet cultural or familial expectations. Second is for personal or emotional reasons. Some women choose hymen repair as a means of emotional healing after trauma, such as the sexual assault. So, cosmetic reasons to restore the hymen for personal satisfaction and for aesthetic purpose. So, preparation for marriage to create the appearance of an intact hymen for a tradition that is associated with a consummation of marriage. So, types of hymenoplasty procedure. So, basic hymen repair. The remnants of hymen are stitched together with dissolvable sutures. This is relatively a simple procedure and is suitable if sufficient tissues are remnant. Hymen reconstruction. If no remnant of the hymen are present, the tissues from the vaginal lining can be used to create the new hymen. This method is more complex and requires a plastic surgery procedure. So how is hymenoplasty performed? So first is the preoperative consultation. A surgeon discusses the patient's goal and expectations. A medical history is taken to ensure the patient is fit for the surgery. Anesthesia. The procedure is usually performed under local anesthesia with intravenous sedation. So surgical steps, any remainings of the hymenal tissue is identified and they are carefully stitched together. If reconstruction is required, the tissue grafting or sometimes rarely a synthetic material can be used. So the procedure typically takes 30 to 60 minutes. So the closure is always done by the dissolvable sutures to ensure healing without the need of the suture removal. So what are the risks and the complications? So hymenoplasty is generally a safe surgery when performed by an experienced plastic surgeon, but there are potential surgical risks like infection, the chances of bleeding, the pain and discomfort during the healing process, the formation of the scar tissue, and the unsatisfactory aesthetic results. So if you are interested in this procedure, you can visit us or consult us by telephonic conversation. So we'll be sincere to advise you, and if you have any queries, you are welcome to our practice. Thank you.